I see general internal medicine patients here at Oak Tree Center for Kidney and Chronic Diseases. And internal medicine patients are just those patients who don't have non-surgical issues. One of my other roles here is to screen donors. Oak Tree runs a transplant program since its inception in 2017. And we see patients who have kidney problems who are to undergo transplant. We prepare them for transplant. And so in this process, there is a recipient and there is a donor. And the donor is the person who gives the kidney to the recipient. So ideally, a donor is supposed to be the healthiest person, supposed to give a kidney without affecting their life expectancy. And that's where I come in, because we have to make sure that this donor is truly a healthy person. Our donor screening program it's very rigorous. We make sure that the donor meets the criteria in terms of age, in terms of health. So we take history and make sure the patient has not had any other comorbidities or isn't likely to be developing the same kidney problem that the recipient has, because most of the time they are related. We also make sure that the patient is a willing donor who is able to consent to the process and understands what the process involves. In the initial assessment of donors, we do some counseling. We do explain to them what the kidney transplant process is all about, how they take a kidney, how you have two kidneys where they are located. They'll take one from this place. It will be a surgical procedure. And then, so that's just like the science of it, how it will happen, and then you can live with one kidney. A lot of the misconceptions we have with the donors is that they think, there are female donors who think they can't get children after they donate. There are certain donors who think they can't do certain jobs. Maybe they can't continue with their profession. People in blue-collar jobs feel like they can no longer continue with their professions. Another one that is a bit political controversial is they think they can do it for monetary gain, which is something that's not allowed. You're not allowed to sell your organs in this country by law. They even have to sign an affidavit that they're not doing it for monetary gain. They are a willing donor, so that they cannot go harassing the recipient after the donation, that they want, certain things, because people can actually really make the life of the recipient very difficult after that. I guess other misconceptions would be how long they stay in hospital. People think maybe you'll be very ill. Most of the time, the donors do very well. All the time, like I said, assuming they are a very healthy donor. Some donors think that they can't donate to people they are not related to, which is not true. You can actually donate to somebody you are not related to, as long as you have a compatible blood group and certain tests which we do to see that the kidney will not be rejected. Compatibility, basically to check for compatibility. We've actually had very interesting stories where spouses have given kidney to their partners, and they've done very well after that. When your kidneys have failed, you need to undergo at least 2 sessions of dialysis, 4 hours each week. So twice a week, you're on the machine for 4 hours. Those 4 hours, most of the time, are during the day. So you lose a lot of productivity. People who are going to school don't go to school. People who should be working are not working during that time. And after dialysis, most of the time, you're too tired to do much. So that day is gone. So that's 2 days out of a week, which you're losing. So transplant has really enabled us to rehabilitate people and send them back to the workforce. People are able to, go back to jobs, go back to their families, not spend 4 hours. They're spending some time on the road to come to get to dialysis, spending 4 hours on the machine, spending another 6 hours. They're too tired to do anything after that. So it's really, I want to say it's really improved the life of patients in terms of working and just making them feel like they can do more with their lives than just staying on the machine.